Okay, Chapter 65, Tactical EMS. Tactical Emergency Medical Support, or TEMS, is a maximum proficiency in-field ALS required EMS response for tactical situations. The scope of practice is dedicated by local, state, or federal medical directions. Many counties have TEMS units, or multiple counties will share a TEMS unit. I know where I live there are 4 or so counties in both Iowa and Minnesota that share a TEMS unit, and it's the unit itself is more of a SWAT unit, but the medical support for that unit would be considered TEMS. There are different models of SWAT teams out there. Sworn law enforcement organic TEMS medic model, or sworn law enforcement organic TEMS. Organic is italicized because it's local. The makeup of the SWAT team, the makeup of the medical person varies. The requirements of the medical person varies. But in the medic model, law enforcement officers are first, paramedics are second. The problem is for TEMS medics is not only developing their skills but maintaining their skills if they aren't called out often for SWAT team support. The fire service TEMS medic has to be physically fit enough for SWAT duties. They have to be very proficient in what they do because often they're doing it under fire, not fire as in smoke and fire burning building, but fire as in being shot at. The problem is also is when you combine these agencies, you've got a law enforcement agency working with an EMS agency, and they have to coordinate their efforts and work together. A hospital-based TEMS unit, of course, is most proficient because the emergency medical support, if it's hospital-based, works in the hospital where they're able to maintain and keep their skill levels up. The problem, of course, working in a hospital and not out in the field is maintaining the physical strength and stamina. So, there needs to be, if you're part of a hospital-based TEMS unit, regular physical exercise and training in order to maintain that. Typical missions that tactical EMS teams are called in for to support law enforcement for barricaded subjects, hostage situations, felony warrants, tactical search and rescues, to guard dignitary and political protection, mobile field force for riot control, extraordinary deployment for things like mass shootings, and then responding for something like weapons of mass destruction or a terrorist attack. TEMS incorporate the TEMS medic into the team during the training, planning, and execution. The best type of medic would be somebody who is ALS trained at a paramedic level because of the additional care that they would be able to provide. As an ALS provider, they can assess and provide rapid, appropriate field care in extremely hostile environments. SWOT assessment triage is a little bit different than the triage that we teach as far as start and jumpstart triage. The TEMS medical person would assess any injured SWAT officer regardless of potential injury to any subject. So this is legally defendable and not what we're typically taught. In other words, if I am one medic and I've got a shot bad guy and a shot officer, I'm going to attend to the officer first. The first priority is always personal safety. So the TEMS person must have good knowledge of how to control hemorrhage and care for wounds, and although they're not participating in a sport per se, many of the injuries that the law enforcement officers may suffer may occur as a result of running, bending, twisting, jumping, common things that you might see in sports injuries like ACL tears and those sort of things. Uh, they also have to have good knowledge of taking care of their officers for common things like colds and allergies and those sort of things. Typical duties for a TEMS EMS person would be tactical casualty care, permission, medical pre-mission medical threat assessment, remote assessment of mission casualties, team member and health maintenance, assessment of suspects before incarceration, medical training of tactical operators, and a physical readiness and qualification at a tactical operator level. So oftentimes these TEMS medics are also expected to know how to fire a weapon, know how to operate in a tactical manner. Tactical skills include having a tactical knowledge as well as being able to do the skills and the mastery of the equipment that you have available for cover, for concealment, and then a working knowledge of things like flash bombs, tear gas, and the weapons that the officers will be using. So if we look at the TEMS triangle of things that a TEMS medic would be required to master, tactical skills would be part of that triangle, field medicine, and that differs quite a bit from civilian medicine, because when you're again dealing with field medicine, it's often under some pretty hostile situations. And then personal fitness to be able to do all of this. Personal fitness, you must meet or exceed those of the SWAT team members. You have to pass the same psychological evaluation exams as a SWAT team. EMS worker stress, uninformed public safety personnel, children, someone you know. So they're referring that as the EMS provider, this stress is certainly no different than responding to any sort of EMS call, in the sense that you may be taking care of children, you may be taking care of someone you know, and you're trying to also keep the public safe. Because during an event like this, obviously you're going to get the looky-loos and the people that are going to want to show up and either see what's going on or actually provide help. And then situational stress. I mean, being shot at, the potential of being wounded yourself has to be a stressor for the tactical EMS provider. Field medicine is something that certainly an experienced paramedic would be able to handle, somebody that's seen these type of wounds, somebody that's very comfortable with, taking care of blast injuries, gunshot wounds, those sort of things. Their tactical casualty care is most important part of the field medicine. They have to have excellent assessment skills to be able to assess quickly. So things like, we talk about assessing quickly, things like blood pressure cuffs go right out the window. As a tactical EMS provider, if I respond to, one of the officers that's been shot, if they've got a radial pulse, there's no need for IV fluids. You're looking for severe hemorrhage, control it, and drag them out of there. Causes of preventable battlefield death, exsanguination from extremity wounds, that if you look at combat casualties in our recent wars, about 20% of the combat casualties were the result of exsanguination from extremity wounds. About 20% were exsanguination from junctional wounds in the groin, wounds that were not amenable to application of a tourniquet. About 1% of the preventable battlefield deaths are related to tension pneumothorax. So being able to do a needle decompression would be important as a TEMS medic, and then being able to manage an airway obstruction if there's a lot of maxillofacial trauma and the airway's obstructed or swollen, and being able to do a cracothotomy. Tactical combat priorities, fire superiority is first. Shoot all the lethal perpetrators so you don't get shot. Prevent further casualties. Get the casualties and all uncovered personnel out of the line of fire. And then triage. Decide which ones get treated first. Stages of care for tactical combat casualty care include stage 1, and that's care under fire. If you've got a casualty who's exposed to enemy fire, you want to stop uncontrolled hemorrhage, and if fire superiority is not assured, then extricate without medical aid. Stage 2 is in a warm zone. This is a casualty on the inner perimeter but in position of cover and concealment. You're going to apply effective tactical dressings, sealed chest, decompressed chest, advanced airway control. Don't set anything down or give away your position. IVs are splinting if there's no immediate pathway to evacuate. Stage 3 is the medical and casualty evacuation. That's the cold zone. That's out of the inner perimeter, out of harm's way. Vehicles are staged there. Additional medical gear is there. ALS medics who can fully stabilize the victim and route are there as well. Training. Most of the tactical EMS providers could function as reserve police officers if they needed to. They're taught the powers of arrest, the powers of search and seizure, not the powers, the techniques of search and seizure, the application of lethal force, basic handgun qualifications. Now there are SWAT mini academies for new TEMS members, or again it may be dictated by the local SWAT team. ATLS, Advanced Trauma Life Support, certainly is a course that a medic could monitor. You wouldn't become certified in it, but you certainly could monitor it to get the additional skills of things like, you'd be able to practice things like needle decompression on either sedated animals. You would be able to practice many of those advanced skills, vein cut downs, those sort of things. As far as equipment that you might have to wear as a tactical EMS provider, it would be body armor, helmets, gas masks. In other words, you're going to have to be suited up equal to the other SWAT members as they go in and complete their mission. As a minimal, level C hazmat chemical protection coveralls and perhaps a positive air purified respirator. Operator level quick draw is every if you look at the military and you look at people actually going into combat, they will have one of these combat application tourniquets on every extremity. It won't be obviously tightened or anything like that, but it'll be available because they could self-apply it if the need arose. And they also carry one battle dressing that is saturated with a hemostatic agent, and that battle dressing would be Quick Clot. Here's a recurrent turn pressure dressing using a here it looks just like an elastic bandage, and they're trying to give you a picture of what a recurrent turn pressure dressing would look like. And you can see that you secure it around the arm, and then in the bottom right hand, every time you come around over the wound, you put a twist in your dressing and you pull that snug, and you keep doing that up and down the length of the wound, and by the end you can just clip it on there, and that twist will put pressure directly over the wound. So it's a good pressure dressing, but it's not a tourniquet. Second line, the medical level, you're going to have one additional tourniquet, one additional tactical battle dressing, 2 shrink wrap gauze, hemostatic dressing, or the granules that you can pour into an open wound, particularly like on the neck, 2 chest seals for open sucking chest wounds, 2 decompression needles, at least 3 inches in length, some OPAs and MPAs, King Airway, cracothoratomy kit, and trauma shears. So that would be the makeup of their bag. And so here would be the equipment that they would have, and it could be strapped on a pack on their leg, just like they're showing you there. Third line would be the medic level backpack. Fourth line would be medical and casualty evacuation platform. So here's an example of a third line medical level backpack located with much of the stuff found in the second line. Armed medics is quite controversial, even TEMS armed medics. There's a lot of safety and legal issues when you arm a medic, even in a SWAT sort of situation. Um, but the general guidelines are that if the medic is not armed, they must always be accompanied by a armed SWAT officer. If armed, they must be trained and be able to qualify with that weapon, just as the SWAT members are, and taught how to use that weapon and when to use it for deadly force. Extraordinary deployment would be like an active shooter or a mass casualty situation. They have to be able to communicate with the other responding agencies as well. So they have to have interoperable communication. They have pre-packed mass casualty medical supplies that can be backpacked right into the scene. And they are probably more well equipped to enter a scene with an active shooter, and should be part of your mass casualty drills. If you have a SWAT team in the area and you're thinking about doing a drill, incorporate them. I know we did a drill one time of a hostage situation in a building with 10 or 12 hostages, some injured, some not, and we had the SWAT team come in, drop bang bombs and smoke bombs, and did all their SWAT stuff, and then EMS in the background waited for them to bring the patients out and that sort of stuff, and it was a very good learning experience for us all. If the shooter is alive and still shooting, they're just going to do simple triage, primary care, following the TCCC guidelines. In other words, control any exsanguinating hemorrhage. If they've got a pulse, a radial pulse after controlling the exsanguinating hemorrhage, and just drag them out to safety. Give a brief size up to EMS responders in a cold zone. TEM medic who initiates care and then leaves that casualty at the direction of the tactical team is not guilty of abandonment. So if you begin care as a TEMS medic and the fire is being fired upon, and your safety is at great risk, and there's no way to quickly evacuate this person, then leaving them is not abandonment. If the shooter is dead or in custody, then the tactical mission is complete and they can secure the scene, do jumpstart triage, and transport. Alright, so tactical EMS, being part of a TEMS unit, might be something some of you may be at some point interested in doing. I have several friends who are TEMS medic. They really enjoy that opportunity. I'm obviously too old and too fat, but back in the day would have really enjoyed participating in that. So with that, if you have any questions, you know how to get a hold of me. Talk to you soon. I believe for one more time.